Hello, welcome to our poster presentation on advancing an equitable Medicaid reimbursement structure for doulas in New York by 2023. The authors are Patricia Bernard, Maris Gelman, Jennifer Gonzalez, and Michelle Zambrano.
Racial inequities in maternal mortality and severe maternal morbidity have stubbornly persisted in New York. Black birthing people are 5 times more likely to die of pregnancy-related causes than their white counterparts. Receiving doula care is critical to improve maternal health outcomes and closing the disparity gap. As trusted non-medical birth workers, doulas provide essential care to birthing people and new parents. They provide informational, emotional, and physical support that often leads to improved birth outcomes. However, Doula Access in New York is still limited to those who can afford to pay for it, and is often inaccessible to underserved communities that would benefit from it the most. It is therefore essential to ensure that doulas are paid a living wage through Medicaid reimbursement to help address racial inequities and overcome the accessibility barriers. Many health departments, legislators, maternal health advocates, insurance, and other key stakeholders are growing interested in increasing access to doula care as a standard part of maternal health care. They are considering legislations at the state and federal levels to reimburse doulas through Medicaid. Too often, though, legislations and policies are proposed and implemented without adequate representation and feedback from doulas and birth workers who are at the grassroots levels and have the most insight on practical solutions. In April 2022, Health Leads and the New York City's Department of Health Maternal Health Quality Improvement Network, MHQIN, reconvened the New York Coalition for Doula Access, NYCDA, which consists of doula and allies to ensure that doulas have a powerful voice in determining their professional standards and help improve racial inequities in birth outcomes.
So in 2022, the New York City Department of Health was fortunate enough to receive dedicated funding to support the work of NYCDA and to bring on Patricia as in the role of a doula advisor and to bring on the Health Leads team to help reconvene and co-lead NYCDA together. And so this partnership has really been able to take off with that dedicated funding. And of course, through this work, we identified one of our priority areas for NYCDA as setting the standards for a living wage for doulas through Medicaid reimbursement. And so we are undertaking a project which uses a collaborative consensus decision-making process, surveying cross-sector stakeholders to identify and leverage points of alignment to design this equitable Medicaid reimbursement structure. And you can see from the yellow box there that we are involving all of the relevant stakeholders in this process so that we will be able to speak with a unified voice on the issue of reimbursement for doulas. And the project that we're undertaking has 3 phases, which are all happening in a very short period of time to ensure that we keep our stakeholders engaged in the process and that we are prepared to work with legislators in the upcoming year. And so in the most recent iteration of NYCDA, we began outreaching to new members in February of this year. And Jennifer, as a community health worker and doula, played a big part in that effort. So I'll let her speak about her outreach and the makeup of NYCDA members.
Thanks, Michelle. So NYCDA was originally founded in 2011 with the focus on increasing access to doula care in underserved communities and improving the interrogation of doulas as value members of the maternal health care team. In collaboration with different stakeholders, the group is effectively addressing health disparities to improve maternal health outcomes in New York. We focused on recruiting members from across the state and wanted a strong representation from community-based doulas of colors. A little bit about our membership. We have a total of 154 members, and 125 members identify as Black and/or African American, Hispanic, Latino, Latina, or Latinx, Asian American, Pacific Islander, or Native and Indigenous. We have 32 counties represented across the state of New York. 108 members are participating doulas, of which 102 are community-based doulas. And 46 are allies, including midwives, OBGYNs, legislators, healthcare administrators, and insurance providers.
Thanks, Jen. So getting back to our timeline for a moment, we had our first coalition meeting in April 2022, which was the first time the coalition met since 2019 due to the pandemic. And at that time, the members agreed on the priority focus areas that we would pursue, which included the Medicaid reimbursement issue. And so in June, our members voted on proceeding with this Medicaid alignment project as a way to reach our goal of advancing an equitable Medicaid reimbursement and getting a living wage for doulas in New York State. And during that time, members also identified the key stakeholders who should be involved and formed a project advisory team of members across the state who should be included in these efforts and help get us to our goal. And we ultimately launched the project in August of this year and then entered phase 2 of the survey work in September. And so during that time, the project advisory team provided really valuable feedback of helping us to refine the survey language and getting it down from a 13th grade reading level to a 7th grade reading level, ensuring that the content could be understood across all of our stakeholder groups. And when the survey was conducted, we had a really high response rate. We had a 45% response rate, and 54% of our respondents were doulas, practicing doulas. So right now we are in the analytics and reporting phase, which will be completed by the end of October. And based on where our alignment areas are, we will co-create our proposal pathway and the pathway forward on this work by December. So we are doing this work in partnership with Alchemy Insights using their evidence-based shelling point technology. And at the start of the new year, we're hoping that NYCDA members will be able to work with elected officials at the federal, state, and local levels to really advocate and implement what we believe will be an equitable Medicaid reimbursement structure. We hope that this will lead to better maternal health outcomes in communities across New York State and hopefully serve as a model for the rest of the country. So we're really excited about this work, and thank you so much for listening. If you want to keep track of what we're doing and other projects that we're working on, please scan our QR code and feel free to connect with us. Thank you.